Hi, welcome back to Future Fast. And once again, we have a very interesting guest. And before I bring the guest into the conversation, uh, first, I hope you're enjoying Future Fast. And many of you who are sharing your feedback, thank you so much. We really appreciate it. And rest of you, it doesn't take much to put in few words, even if you want to criticize. But so far, any recommendation or reference also helps. So please do communicate and engage. And majority of you are just consuming the content. I understand this is a trend with most podcasts, but we really appreciate if you subscribe to it because you will keep getting updates on who's the next guest we have, and we pretty much bring a guest a week. So it would be good. And another thing is that majority of you also miss out some parts of the conversation with the people we bring in because we do our podcast in three parts. So if you subscribe to us, you will not miss out on any of the parts of the conversation. So please do consider subscribing. And with that, thank you so much, and hope you enjoy this conversation. And we have Dr. Shikha Dhawan. Uh, she calls herself Portfolio Living, and we'll go into the conversation. Shikha, welcome to Future Fast. Thank you so much for making time to be here with us. So I want to start with Portfolio Living.
Thank you, Nanjunda, for having me here. It's a pleasure to be on Future Fast. And for me and for all of us, we fancy a lot of things in life, and you only live once. So, I want to do a lot of things at the same time. So, I say portfolio living. That's what I do because I'm a trained as a microbiologist, a molecular biologist, in fact. But then I like to do other things also. So I have a lot of inclination for rural livelihood and women empowerment. So, I'm trying to do all these things in the same time which God has given me in a day. That is why portfolio living, enjoy what you do because you only live once. So it's a portfolio of things we do.
Interesting. So maybe I can qualify from the broad definition of it. So,
Yes.
thank you. So, can you share your journey of how did you get to the point of doing a portfolio living? You said you also are a trained biologist, microbiologist. So, perhaps that was your interest at the start of your career.
Yes. So I've done my graduation, master's, and in fact a PhD also in microbiology with specialization in molecular biology. And in fact, I was the first microbiologist of the department because that was the era in which microbiology was catching up. Molecular biology was catching up. And we were trying to link microbes with the biotechnology and cloning aspects of it. So I belong to an era when cloning was catching up. So that is how I started my journey. And from there, I have a passion for good food. So, it got me connected to a lot of villages in India because, I was curious about to know what is on my plate. So I was looking for food that is free of additives, free of preservatives, free of pesticides. So, that is how I got interested in working with farmers. And when you go to a village in rural India, you gradually move to what the village is all about. So then you interact with the people who are into health there, the didis or the health didis as they are popularly known, and also the self-help groups. Now, these are women groups which are generating livelihood for themselves. So that is more about getting them financial inclusivity so that they have bank accounts, they are financially independent. So, got wrapped into all of this. And being a microbiologist, I could bring my microbiology learning into it because, for every angle, I was talking about how to put in microbiology, how to put in biotechnology, how to put in data capture, how to make it more data rich. So, that is how my learning has been. And this is why I call it a portfolio living also. It's all about the passions which I've been pursuing from what I have been taught formally to what I want to be. And I'm still into microbiology in a big way. So I work with development sector programs that are run by Government of India. So I worked to provide technical assistance to Government of India, tuberculosis and HIV/AIDS program. And during COVID, we also have run a lot of projects, again, funded by government programs on COVID, dengue, chikungunya. So, microbiological aspect has always been with me. Touched upon infectious diseases, and from there also worked on non-infectious diseases, because these are the ones which are attributes to health. Something like, if we talk about tuberculosis, now the bigger bane is people who are suffering with diabetes, hypertension, and other comorbidities like TB and HIV is a double whammy. So all these things, when you see the bigger picture, so you see that everything is related. So that is how you add up to your learnings. And on the way, I also developed a passion to be a teacher. I take a lot of courses on leadership and management in health, and talk about project management, program management. So you keep on building to your skills. And I have been a student, a lifelong student, if you ask me. So I'm very curious to gather knowledge, always keep myself updated. So whatever is the latest thing, I want to read about it, whatever happens in the global arena with regards to public health, or also with regards to AI, or generative AI, as everybody is talking these days. So I try to keep myself updated. So the key is to read and be inquisitive. So that is how I define my life journey. I'm very inquisitive. I am very inquisitive to know new things, and also passionate to follow what interests me at the global scenario. So that is how my journey has been, a continuous learner, and I'm still learning. I have formally trained myself. When I ran a communication project for a Government of India program, I actually did a formal training in communication and public health, because I'm a microbiologist. But to deliver a project on communication for Government of India, I felt the need to equip myself with the right knowledge. So, you may not be the expertise, because my expertise is microbiology. But then to deliver a project well, I took it upon myself to had that to build up that required skill set. And there are a lot of ways you can do that. So I'm a continuous learner, and I'm growing every day and trying to make myself a better version of me. That is what I am.
Wonderful. So, how you did start your career in the, though of course you say that microbiology is part of your journey all through, but you actually got started professionally in the within the same space, right? And uh, only then you moved into impact space. Is that correct?
Yes. So it keeps on evolving. Like my interests grow, my portfolio grows. So my passion about life, my passion about what all interests around me. And of course, food is the center of everything. So I need good food, because, happy mind, happy soul, happy people only deliver in this world. I'm very confident for that.
And so, yeah, you mentioned earlier that food drew you to villages. So,
Yes.
what was the trigger when you just said food drew you to villages?
So, I wanted to meet the people, the farmers who are growing the food that I'm consuming. So I started with support of few groups and few people with few connects who are working in Unnat Bharat Abhiyan, and also connected with certain incubators, and they were working with women self-help groups and startups. So, for me, I wanted to know how they are growing it, what pesticides are they putting in the soil, what is the water requirement, and, with the drones coming in, so they could also harness the utility of these drones in agricultural practices. So, all these got me curious into how the food is reaching my plate. And I was more into, I want antibiotic free food. I'm a non-vegetarian, so I wanted to make sure what I'm eating is free of hormones, free of growth hormones, free of antibiotics, and milk, what I'm consuming, if it's organic, well and good. And especially this particular region in Uttar Pradesh is the sugarcane belt of the country. So, a lot of good produce coming from there with regards to value added products from jaggery. So, I developed a keen interest for them because I got associated with women self-help groups who were making these products out of jaggery. So, the thing was to ensure that they were using pesticide or chemical free products, and they were adding value to it because this was a particular woman who was adding beetroot to it. So this was very fascinating for me. So never had jaggery with beetroot. So if you go and ask these people, they have very simple stories to say. This lady, a very enterprising lady, she said, I did it for my children. I wanted my children to eat beetroot because she said it's a good source of iron. So perfect, bang on. But how to make kids eat beetroot? So she developed this process to blend it with jaggery. And there it was this awesome, I would say, a value added jaggery product made with beetroot. So, I tasted it and I'm also a big fan of beetroot. So, this was the best way you can mask and eat beetroot. So I started giving it to my friends, family, and also doctors I work with in Delhi hospitals, AIMS and Safdarjung. So, I told them very clearly, this is for our sweet cravings. So, we Indians, we always crave for something sweet after a meal. So, why not have something
Or
which is,
sometimes even before a meal.
yes, so why not have something which is healthy and we know who has produced it? We know it is produced hygienically.
So,
Yes.
so it is packaged and sold and stored?
No, that's the
Uh-huh.
beauty of it. They are making it in small batches. But our continuous endeavor is that we bring it to the market also.
Okay.
So we are trying to develop the commercialization aspect of this as well through my NGO. And I had this bright idea one day also to patent this technology also. So these are all ongoing endeavors. I'm on it. So want others also to taste all these good foods which are actually local recipes emanating from our local villages. So this is passion about food. And when I go to these villages, um, they are, I was also fond of getting fruit direct from the tree. Actually fruits ripened while they are standing in the
Yeah.
tree. So,
Yeah.
that was also a passion. I wanted mangoes. So they took me to these mango orchards and I was like, no carbide in my mangoes. They said, Madam, these are ripened on the tree. So, that's a blessing. And, once you start craving for such kind of food, you keep on exploring more and more options. And, this was the sugarcane belt. So they told me we can also make hygiene juice from sugarcane. So, then we went ahead and explored options with them to extract sugarcane juice hygienically with no flies around. And then they add all these mint and lemon to it. And believe me, I was not eating sugarcane from vendors on the street, but this I could because I was sure of who has grown the sugarcane, who has extracted it, and the hands which served me. So, it's a total passion to know what I'm putting in my body. And they tell me it's an energy booster, sugarcane juice is a liver detoxifier. If you go to these villagers, they have this old world wisdom. And you really want to listen to them. And then then these women were very enterprising enough, they wanted to make a lot of sweets out of milk, which they get from cows in their own homes. So, it keeps on adding up, Nanju. So, if you're getting good food, if you're getting fruit which have ripened on the tree, so, this is what life is all about. Why not? Do you agree or not?
I, I don't think anybody can disagree to that, sir.
Yeah.
Uh,
And, the microbiology also comes in because then when I'm talking about the beetroot and jaggery, I'm talking about the shelf life. I'm then talking about will it stay at room temperature? Do I have to refrigerate? So, the scientific inclination, the scientific mind is always wondering, asking for questions. So, that is how all your life skills get acquired to what you do currently.
yeah, that's true. And how do you help them now with what is it, Abhya life, right?
Abhya
Your
life, yes.
okay. So one you basically are trying to help them market it,
Yes.
or perhaps even you're saying you want to even get a patent. So you basically start with them from a point of even registering an entity to filing for an IP or IP application, and then do branding, and then stitch up some distribution ecosystem. So you're doing every aspect of it.
Yes, so Government of India MSME Ministry also has a lot of schemes for nano entrepreneurs.
Okay.
So, we are trying to link them with that as well. So,
Okay.
they are making good products. So,
Mm.
to package it, to brand it, to take it to markets, and then to diversify and give them new businesses. So, this has all been my endeavor throughout. And in addition, we are helping them build leadership skills. So, it's
Mhm.
not like that I'm the brand ambassador. If this woman has made this local value added product, she should be able to talk about this product on her own. So, we are trying to develop their leadership skills also to talk about their product in front of an audience, and also building their capacity and training them and enhancing how they view their product as well. Something like helping them to develop the right label, to develop the right shelf life. I mean, these are the things which I'm constantly evolving, because what I found in the village is like there are these women who are making pickles and jams, and they're very fond of putting a white powder. I say I want it preservative free. They said, Madam, it only has a white powder. Now that white powder they don't understand is sodium sorbate. So that's a harmful preservative. So, it's a continuous learning for me and them as well, that when I say preservative free, so, you decrease your shelf life, the microbiologist is thinking, but then you give me a product, okay, which lasts for a month. Okay, so we can put it accordingly in the label, get a FSSI approval as well, list all the ingredients, but we tell our people we make it in small
So
batches
you help with the
and make.
certification as well.
Yes, yes. So no, this is all what we bring to the table. I work along with a lot of partners in this. So there are other partners who are doing these leadership skills, capacity building. So we work along with a lot of them because it's not a single person who can lead such a big show. So it's all about team building and working together as people who share the same vision. So that is important. Keep connecting and growing my network. So I am associated with Merit Institute of Engineering and Technology. So they have adopted these colleges and villages around Merit area, and trying to help these women and farmers do good. Now, women are structured as self-help groups, and farmers are structured as farmer producer organizations. So, we are trying to bring a
Okay.
sense as per the government system, and there are other partners across the length and breadth of the country, because we are trying to introduce integrated farming methods, integrated pest management. So I work with startup. In fact, I work with startup at Bangalore also. So they are making this consortium of microbes that can add to the nutrient of the soil rather than putting chemical pesticides. So, there's a lot of passion. If you think about food, if I want to eat good food, there are a lot of things which are associated with getting good food. So, I'm trying to build that whole ecosystem, trying to plug the holes, if I can say, by bringing people with the right expertise. And then I also work with accelerators like India Accelerator. There's a very important NGO called Jijivisha Society. So they are helping us train these women in making jute bags, organic perfumes. So, you ask us and we are doing it. And in fact, Nanju, I would like to tell a very important story, because I'm into women health and hygiene also. So I work with a startup called Mild Cares, and we help them switch all mensurators in a village in Meerut to menstrual cups. So, this was coming to overcome the perils of using unhygienic products. So they had a solution which lasted for 10 years. So, it saves sanitary pad waste going to the landfills, which is a very big accumulating problem these days. this product being reusable for 10 years, handled well, it doesn't bring an economic burden also. So changing mindsets, making the people in village adopt what is accessible to us in the cities, that has been a continuous endeavor to change the life of less privilege. That is a motto I live with, Nanju. And of course, whatever learning is comes along. When I talk about women health and hygiene, so they want to talk about urinary tract infections. They want to talk about how to handle and maintain these products hygienically. So these are all things which I can add value to as a microbiologist. Though I'm not a formal doctor, but my microbiology helps me there, because then I can discuss all these issues which women ask about in villages. So that is how it's always a pleasure and portfolio living for me.
Right. And this is a full-time activity that and I guess you also mentor startups, you said. So the
Yes.
startups are also in the primary health space, or in the microbiology space, or food. So which space are they in?
So
Or which
that's
of the portfolios do they belong to from your
so
perspective?
that's very interesting question. It always starts with microbiology. So
Okay.
when I got on these mentor board or advisory forum for these startups, I'm always called in as a microbiologist, because I was with a startup. I was asked to mentor them because they were making reusable sanitary pads from hemp. Right. So I was brought in to talk about microbiological
And is
strategies.
that product out in the market?
Yes, they're working
Okay,
for it. There are a
interesting.
lot of products. In fact, there are diapers also made from bamboo, hemp. We all are talking about sustainability and environment-friendly products. So, that is how the Atmanirbhar Bharat startup is also shaping up.
So,
So,
is it fair to say, put bamboo and hemp together?
the thing is, the people who are working with bamboo, they're largely from the northeast part of the country. And the people who
Ah,
are
okay.
working in hemp, they are part from other parts of the country where you can grow it for medicinal use.
Hmm.
So there kind of diversity within the country, and India is a big country with so much things going on. So no, I've not seen bamboo and hemp together, but I have seen them as
No, no, I
standalone.
was only thinking from a point of bamboo consuming so much of water. But yes, when you say
Yes,
northeast,
yes, yes,
they have a lot of water. But there are people who come up in South India and saying that they want to work on bamboo. Say, is that
yes,
and then they say sustainable.
yes.
They just don't add up. That's why I was asking. So if
I
they're
I
northeast,
I
bamboo
I
makes sense.
agree. So, we have to be cognizant of what our local resources are.
Correct.
That's why nature gives us seasonal things. Though we are trying to have vegetables
Everything
and
every
fruits
season, all seasons.
365 days around the year, but things are seasonal because of the climatic and the environment need. I think if you stick to what the local thing is, because South is very much into growing millets, which North is trying to catch up. So, the thing is, if we do best what we are good at, it really helps. Be local, be vocal.
Well, but at the same time, right? I mean, the argument of what we are good at or what is native, because a lot of things have changed, right? I mean, see, for one, now in South India, we always believed for a long time that paneer is a North Indian staple diet.
Okay.
But paneer didn't exist in India till Mughals came in, right? So it was not there always. And
Yes.
people take it for granted that potato is a staple diet of North,
North.
which again is a late entry to India.
Yes.
Like how in Kerala they have, I'm forgetting it, they call it kappa, I'm forgetting tapioca.
The
So
banana tapioca. Okay. Okay.
uh,
Sweet potato.
sweet potato. So this is not native to them, but it's today regarded cultural. It's a culturally identified with Keralites, and which is again not native, which was
Yes.
brought from Portuguese. So I think it's okay to uh, experiment with food, but what we need to be cognizant is the impact on the overall
Yes.
ecosystem and sustainability. Like growing bamboo here
Yes.
and consuming so much of fresh water
Yes.
while we just don't have enough water. So
I fully agree. It's good to experiment. It's good to be curious. It's good to know
yeah,
if it can grow. That's how we got kiwis and dragon fruit introduced. They're growing so well. Uh, Arunachal Pradesh is growing a lot of kiwis now. So, people need
okay.
to experiment. I got to know many villages in Uttar Pradesh. They started dragon fruit. That sells, gives them a very good price. So why not? Introducing them is good as long as the biodiversity ecosystem, which we realize on a later on, is maintained. So
Uh, yeah, at least yeah, from a dragon fruit point of view, it makes sense because it anyway consumes very little water.
yes,
It's more of a cactus family. So
yes.
so
So so
yeah,
so so our farmers are very innovative. They hear that okay, this is the one which fetches a lot of price in the market. So real, this
yeah,
is
that was my learning too. I
yes,
found farmers to be have
yes,
better understanding of economics than
yes,
people who have studied at least not fully economic, but at least have studied are formally introduced to economics don't have that
yes,
understanding of
yes.
economics.
I fully agree. So I learned this from a farmer in Mirzapur in Uttar Pradesh. He told me we are very successful in growing these exotic fruits because they are in demand and they're sending it across the country. Despite the logistics cost, they are making a lot of profit. So these are the actual people who have their ears to the ground, I would say. For them, it's
Uh,
always business, always what the customer wants. So, this is what we try to teach to startups who have been formally educated, but then these are the actual farmers who know what the customer wants.
and may not have formal education to
Yes,
such an extent. And
yes,
yeah,
yes, totally agree with you. And
yeah.
I want to tell you because we're talking about local food habits. There's another thing to it. When I work with the tuberculosis program of Government of India, so it is said that a TB patient who is getting treated for this disease needs to take a protein-rich diet. Right. So what the experience has been that you cannot give them high protein, something like a egg or across the country. You have to adapt their food to their local taste. That works. Making them all eat eggs does not work. It could be religious sentiments or they're not used to it or, they don't like the smell. Forget that. But, what works is what people eat. So, making them all these protein blends from the local cereals, that is what worked. You have to always keep the culture sensitivity, what the people are used to. So that is always a part of the package you need to consider if you have to deliver public health. And
Oh, one more thing I want to ask you. You've been in public health. Your personal curiosity is in food, and you're a trained microbiologist and molecular biologist. So, see, I read a report, and also general observation can confirm it that India produces more paneer than milk.
okay,
I
so
mean,
where does
it's
it come from?
logically not possible, but it's happening, right? I
Yes,
mean, this was the report I read, and which is also very evident. The amount of milk people consume as milk, and then milk with coffee or tea. We are not. I think even in my personal circle, there are very few we can count who drink black coffee or black tea. Most people with milk, and
yes,
then pretty much every sweet, right? It's got a milk base, and we also have a habit of in South India eating curd rice
yes,
or drinking buttermilk, as we call it, or chas, right? And then lassi. So
yes.
we consume so much of dairy, and
Products.
then there are India is becoming a big chocolate market as well,
Yes, yes,
and paneer. So effectively, paneer is like 1/7 of the milk in the sense of how much. And as such, I think what 200 grams gets produced in a liter, something like
yes,
that, right?
yes.
So what's happening? I mean, I mean, I understand the demand. People like to eat, but how does this get justified, even factory produced? uh, junk called paneer and made to eat everywhere.
So you're entering a very interesting topic of food adulteration. You have very rightly said there's not that much milk as we are consuming. Animals are not giving that much milk as we are consuming.
Yeah, and
So is it synthetic milk or is it coming from different source? That is a gray area of food adulteration.
but how is it happening in so much of scale? Because yeah, a
The demand
few
is high. The demand
no
is high.
demand is high, but somewhere the supply is being met and so consistent. And how is it? I mean, are they
Yeah.
organized factory? I mean, adulteration at a scale that is happening, which is scary, right?
Yes, it's scary indeed. So that's why I'm saying we have to be very careful with what
See,
goes in our
I
body.
I traveled
Yes,
some of we traveled to UP. See, here people eat paneer, but it's like in a full meal, it is probably less than 10% of it, and there it's primary thing, right? You eat
yes,
paneer with your roti and paneer with rice, so it's like what you primarily eat is paneer, and other things are with paneer.
yes.
So that and uh, so okay, we went to Ayodhya, right? It's a small place. But I could see that there were nearly 2.5 lakh people there, right, in that small place. And there's one big street with whole lot of food joints, small ones, and pretty much everybody selling same stuff. And
Okay.
pretty much everybody have paneer. And there are sweet shops alternating almost so many sweet shops. And everybody selling sweets, which are also milk based.
Milk made from milk. Yes.
Yeah, I mean, at least milk based, whether
Yes,
it's
yes,
actually
yes.
made from milk. So,
Yes.
where is the supply coming from? I got scared to eat it,
So, so,
and
so
no other option.
it's no, no, it's good to be scared. Go for products which are made from chickpea, sweets which are made from chickpea. You can avoid these milk-based sweets, especially during the festival seasons, because you are right. You really don't know where the milk is coming from. So I would want to leave this question like we need to know who is making my food, who is packing my food. Something like in the army, they say who packed my parachute.
All right.
It's something like we cannot have a blind eye. That's why I went to these villages. I want to know who is making my food. So it comes from there. So if you are ignorant, ignorance is bliss. Just consume it, laugh your way to health. Don't land up in a hospital. But if you're really conscious and if you think your stomach is going to refuse this adulterated food, I think it's best to avoid if you have a doubt in your mind, because we are not producing that much milk as we are consuming. It's a fact.
All right. I just want to ask one more question. So you go to villages, you talk to them, and all that. See, one is that which is evident and obvious that these farmers are far more economically savvy
Yes.
than we urbanites, right? That they are more savvy to what sells, what they want, and all that. But are they as conscious about what goes into making the food, like what we are talking about?
Oh my God, don't get me started here. So, I know this particular farmer who, now this fellow is in Haryana and he makes ghee, right? And
Yeah, that's another thing we
yeah,
consume significant and butter. And India is
yes,
becoming a big market for cheese, and it's
yes.
continuously growing year on year. So, sorry, yeah, please
You know
continue.
what I was trying to say is he has posted it on YouTube also. The process how he's making this ghee, this clarified butter. It's awesome. For him, cleanliness, God is where cleanliness is. If you see his kitchen, sparkling clean, utensils, cleanest I've seen. So, and he keeps chanting hymns. The wife is smiling when she's churning the milk. You feel like buying that product. And he vouches for purity. He actually, because I'm an organic freak, he vouches for all organic ingredients. He has also talked about what he's feeding his cows. So that is the kind of confidence you get. And do I get my clarified uh, butter from him? Yes, I do. So, this is what I'm saying. You're as good as you are aware. You can close your
But is
eyes.
it, can you say that that's how most farmers are like? It's not right. General perception is villages and farmers are not as hygienic as, I mean, at least that's the general perception from an urbanite, right?
Yes, so you have this microbiologist also thinking, because I sometimes refuse water because I know it's not filtered there. It's coming from the ground level. That's a different story. But their kitchens are clean. What problem I see, they might have rodent infestation. They might have
Mhm.
cockroaches and rats running. So,
Mm.
this I try to tell them. If you are making something for us, for our consumer, if I'm taking it to my friends and family, we need to get you pest control. Pest control is something I've also done in the public health departments. That was a
Mm.
project I've run with Government of India, Indian Council of Medical Research grant. That was a parameter where testing for tuberculosis is happening, along with where the drugs for TB patients are getting stored. We
Mm.
ensured they had pest management in place. So, saying that villages could be dirty, a cleanliness is a state of mind. You're as clean as you think you are.
So it's a general bias we most of
Yes,
us carry
yes,
than the actual
yes,
reality.
yes. And
Okay.
because I'm not quoting anything in particular, so I can say this. We've also seen instances of monkeys happily chewing and having a gala time on what comes for patients or what needs to go for the public things. All these are happening. So these checks, quality checks, quality assurance needs to be built in if we are serving others, whether it is food or whether it is medicine, or we are rendering primary care, secondary or tertiary healthcare services. I want to tell you, I want to take this conversation from why we all go to private hospitals. Why don't we trust our government
I
ones?
want to keep that conversation to the second part
Okay,
of our
okay,
conversation. I just want to bring you back to the food part.
okay.
You mentioned you're very concerned about what you eat, what comes onto our plate, where do they come from,
Yes,
the source,
yes,
and you
yes,
also mentioned that you're a non-vegetarian,
yes,
right? So you're sourcing food where well, rather tracing of food source took you to villages and all that. What have you done anything to look at to your other cravings of non-vegetarian food? How was that get addressed? How is that scenario in India?
So, for there, I want to say that read the labels, right? Read labels which say antibiotic free, hormone free. There are brands there because,
I've
we are
I've I've
demanding.
started noticing it only in the last 1.5 years, to be
Yes,
honest. I
yes,
didn't
yes,
see this
yes,
antibiotic free in the meat
yes,
stalls, right? So I don't know, something has changed where
yes,
they've actually started putting up announcing it. Perhaps they are. So if they
yes,
claim it, they must be. So that is one. Okay.
yes. Be a conscious consumer. That is all I need to say. Read the labels because there's a very big social media campaign going around. Read the labels. So, this I've been doing for life. I've been reading what I'm consuming. So, avoiding certain processed foods, avoiding tinned and canned foods, it's a conscious choice. So, that is what I would want to urge. Read the labels and read and Google it up or whatever you want to say, search, look it up because people have stopped saying Google, look it up on AI tools. Please find what the label means. It really helps. Because, I went to a forum and said, okay, I'm conscious, but my brother, who is a chartered accountant, is not. We are. I wish because you said the podcast is future fast. Here I would say in future, I would want that we are so honest about what we are selling to the consumer. I'm conscious, I could read the label, but my brother, who's a chartered accountant, or my husband, who's an engineer, may not be understanding the label, even if he wants to search it up. Give us that food so that what we are consuming nourishes us and not makes us sick. That is something I wish to happen in the future. The food on our plate is safe because everybody can't run to a village and know who is growing their food. Everybody may not understand the label. They can search up the label. I want food which is safe for everyone. It's not for me who can read and understand it's antibiotic free, it's growth hormone free. I want that in the future. We want to put good food in our bodies. Future
Well,
fast.
that's a bit unfortunate that we want uh, it to happen in future. It should be happening all the time. So
Future. What do you mean by future? For me, future is also tomorrow.
yeah, no, I'm saying, see, probably today a small percentage of us can afford to have food which is grown or produced responsibly, and they also come at a
Yes.
premium price. See, that's
Yes.
the part, right?
Yes.
So this premium to quality has to go. I mean, quality has to be
Exactly.
available at every place,
Yes.
and that's the only way where even an unconscious or not
Yes.
somebody not buying consciously, right? Not
Yes.
unconsciously, but somebody
No, I
buying
get it.
without consciously
Yes.
thinking about what they're buying should
Yes.
also be buying something healthy, and that is possible
Yes.
if we can have it as the way of doing.
The standard quality processes across the value chain. It
Hmm.
doesn't stop there at the shelf. It's at every level.
Yeah.
From
Today
who's producing is
most farmers are driven to organic or most of these things because they see a premium aspect to it. They can
yes,
make more money.
price.
So that is which is one side is a good part of it that okay, good, somebody is going to make better money, but that has to translate to every level. And also you say free of pesticides and government
Yes.
subsidizes pesticides. So probably we'll take it up in the second part because you've
So
been
there are all
involved with that.
pros and cons to everything.
Yeah.
That's why it has to come consciously. Be aware of what you put in your mouth. That is what
Yeah.
I'm saying. What
So
you put on
where
your
did
plate.
this I mean, when did this thought process get into your conscience? Was that a trigger for some action, something that happened in your life, or was that just been your upbringing from your childhood? Where did that come from?
It's something like we're seeing a lot of cancers happening. Why so many cancers these days? It was not heard so often, though there's a lot of media around, so probably we have more access to news. Despite the fact, there are a lot of cancers, a lot of heart ailments, though we can argue it's an unhealthy lifestyle also. We may be just sitting and not moving around. So, a lot of things said and done. Because as a person who is reading about health issues, so, that is quite striking. A lot of cancers are coming up. So, no, is it the pollution we are breathing in? It's the food we are taking in? It's the pesticide use? But one thing you need to agree, if you look up pesticide usage across the country to get more yields, it has gone drastically. At the same time, now we are becoming environmentally conscious and we're talking about soil health, soil replenishment. We want to go back to the organic ways. So, everything is catching up. And I think going back to sustainable, environment friendly practices will give us better yields. So, if I say in the near future, if the entire value chain across what we eat at our homes is taken care of, is quality assured, these changes need to come at all levels.
So, what what is Dr. Shikha Dhawan reading now, or what kind of podcasts do you listen to or
So,
follow?
so my interests are very varied. So, I try to read a lot also because that is something which we have given up because of the internet era where everything is available at the click of fingers. I read a lot of books. I'm currently reading Wise and Unwise by Sudhaji. So, a lot of things catch my fancy. And if you talk about podcast, I do my own cooking. So that is what I listen to when I'm cooking. So when I'm relaxed, I can listen. I listen to anything that pops up because AI is very smart today. You don't have to go and look. They give you suggestions based on what you have been searching. So it comes up about COVID vaccines. It comes up.
Well, incidentally, I was talking to somebody who was actually telling me that uh, the search meant searching for what we want, but somewhere the with more and more AI getting into search, now we are not getting what we want to search for. We are getting what the system thinks we
They
need.
think we want.
Yeah. So is that a okay thing to allow the system to decide what you need?
It's okay, it helps also, but then I filter. Then the choice is
Right.
mine. What we
Right.
all have is choice.
Right.
The choice to
No,
what
but
to scroll.
somewhere this will you will end up creating your own echo chamber, right? By doing so particularly.
But I find it quite fascinating because it picks up what I've been looking on the net.
Hmm.
So that's interesting, no? So they customize your ads, they customize the topics which you want to read, they customize what you want to listen to.
Yeah.
But
Yeah.
then of course I'm the human brain, no? So I'm smarter than all of them. So I look up new things. I come across like I was like this villager is going dragon fruit. I looked that up. So I can also train AI, So now throw me things on dragon fruit. So I keep challenging it. So it's like technology is always there, but need to be smart enough always to mold it for my benefit.
Yeah. Yeah. Fair. Fair point. But perhaps you could get on to Future Fast as well. Put that into your list. Till
Sure, sure. It goes
uh,
without saying. Yes.
till your AI starts recommending you on that.
That's for sure. And it's I'm very good on LinkedIn. I'm trying to build a brand on LinkedIn. So that also gives you suggestion like this only. So it
Hmm.
makes my job easier. Because now I'm reading a lot about social stock exchange. I'm reading a lot about environmental, social, and governance. So it is giving me options to join such groups.
Oh, well, if you're talking about social stock exchange, perhaps we'll take it up offline. I talk about tokenization. So that's my favorite topic. So
I'm not an expert. I'm learning there.
uh, uh, I claim to be an expert there. So I'll be happy to share that. I'll perhaps share some links to
Wonderful,
you as well.
wonderful,
So
nice.
wonderful. Thank you so much. Is there any other recommendations you want to make quickly, books and podcasts before we conclude this part?
I just want to say, keep your interest live, read, hear, lot of knowledge out there. Everything helps you grow. You should never leave the habit to read and listen to good podcast. We have access to these things. So find topics that interest and delve deep into it. Knowledge never goes waste.
Wonderful. Thank you so much. And to the audience and listeners, you just heard us. Please do share this. And I'm sure you're perhaps curious what are we going to talk in the second part. And uh, I would want to put it on the table that want to take up, primarily discuss the kind of work she's done in the public health space and pick up thoughts and brains on what her observation and experience has been. So that's where the conversation will be. And for all of you, those of you who find that is your interest, please do come back, do share this conversation. And till we come back, enjoy the ride. Once again, Shikha, thank you so much for being part of Future Fast and
Thank you
really
so much,
enjoyed this
Anjumdan.
conversation.
Thank you for having me.
My pleasure. Thanks.
Pleasure.